Well, hello there. My name is Nicola Connolly Byrne. I am the personal empowerment specialist, and you are very welcome to my podcast, Soulchats. We normally speak here about people's personal and spiritual development and how they have empowered themselves to do that. But this time, we are shifting gears and we're going to speak about health empowerment and all things perimenopause, menopause, and HRT. I have some amazing guests lined up for you who are going to share their stories about their personal journey and knowledge around HRT or the lack of it. Please bear in mind, we are not medical professionals, so we are not offering medical advice. We just believe in the power of shared learning, so please do speak to a doctor if you feel like you need to. So let's jump right into new territory. Let's get going and buckle your seatbelts. Well, good morning, Eileen Burke.
Morning, Nicola. How are you doing?
I'm great. How are you keeping?
Not too bad.
You're looking
Great.
fantastic.
As are you, bright and colourful. That's what I love to see, especially in the autumn, you know.
Absolutely.
We're coming into the dull months.
It's gas actually that you say that, because I was having a bit of a wobble yesterday.
Okay.
And I discussed this exact thing about colour and the effects that it has on you with a beautiful girl by the name of Katrina Carroll. She's a fashionista who did a podcast with me yesterday. And today I said, colour all the way.
Bring it on. Bring it on.
Colour all the way. It's going to help me. So listen, let's get back to you. Let's get back
Absolutely.
to you. Eileen, I'm so grateful to you for giving me your time, and for all the listeners, because you are one of the most knowledgeable people that I know when it comes to perimenopause, menopause, HRT. So let me give you your official bio so everybody knows exactly who you are. So this is Eileen Burke. She is a nutritional therapist specializing in female hormones, menstrual health, fertility, menopause, and perimenopause care, as well as weight management. So listen, we all need to know.
That's a lot.
We all need to know about this. Now, my first question for you is, how did you get into all this?
Oh, it's a long story actually, Nicola, because over the years I've actually, I started out in a very different direction. I was in when I trained originally, I was training in the States. I was a special ed teacher, came back home to Ireland, had my family. I didn't actually really know much about nutrition and whatever. So I, over the years, have struggled with weight, but also with mood, with symptoms, very, very severe symptoms of period pains and heavy, very, very heavy bleeding and things like that. And I had absolutely no idea that anything was connected at all to what I was choosing to eat, or to what, even drinking alcohol or anything like that. So it wasn't until literally within the last 10 years or so that things started to come together for me and collide in different worlds in terms of what I was doing with parents and children in and around behavior and how different things were affecting them, whether they were hydrated or not. And, I got these questions from parents: how can we actually feed our children? What can we do? And I said, to be honest, I don't know much about this, but I'll go and I'll look into it. And my initial intention was to just go and maybe do a simple nutrition course and to find out about, how people could maybe plan lunches, that kind of thing. And when I started on the nutrition journey, and as a health coach, initially nutrition and health coach, I absolutely just fell in love with the area, and my mind was blown when I saw how the effects of food and everything else.
Yeah, I love that when your mind is blown, because when your mind is blown and you're passionate about it, lean towards that.
Yeah. And that's exactly what I did. I immersed myself in it, and I didn't just stop there. I went on and I became a nutritional therapist. So it took another few years to finish with clinical practice, and really delving into the research in and around, everything to do with cardiovascular disease. We had to cover everything from, pharmacology, you name it. So you really get an in-depth kind of view.
So see the way you said there, nutritional therapist.
Yes.
Is there a difference between nutritional therapy and a nutritionist?
There is, like, for somebody.
Okay, I'm so glad I asked that.
Very much so. Like, the term nutritionist can be used by pretty much anyone who maybe even only did a weekend course or something like that, or they may choose to just use that term, and they may actually be a nutritional therapist. But when it comes to the nutritional therapy, you do have to have clinical practice. You have to have gone through this at least 2.5 to 3 years of specific training just on the therapeutics themselves, you know, on how supplementation works, and you're licensed then to actually to work with supplements, etc. But you wouldn't be as a nutrition and health coach or as just a nutritionist. You know, they could give advice on your diet and on your lifestyle, but they couldn't actually then recommend supplementation, because you do have to be very, very careful when you're you know, looking at how something might affect somebody's body.
Yes.
Because you need to know if there's any contraindications with medications.
And the contraindications are huge, Eileen.
Totally. And a lot of time people don't realize that. You know, we might say to a friend, just out of being helpful or whatever, you know, oh, you should try such and such, you know, whether it's to do with an antacid or whatever else, and not realizing how their body is going to react, because everyone is so unique.
Absolutely.
So it's such a personalized approach.
Yeah. It's kind of like when I found out the difference between hypnotists and hypnotherapists.
Yeah.
I was floored. I was really floored, Eileen. But anyway, that's a whole other podcast. Now, tell me this. When did you start off really working with women with regard to their own menstruation, perimenopause, menopause, HRT? When did that kick off for you?
That kicked off pretty much immediately, because some of the...
What year are we talking now?
Oh, so you're talking the first year, so from 2016 onwards.
Okay.
So when I first started as a coach, that I would have initially started off with the whole diet and lifestyle approach with people. But as soon as I could hit the ground running and start to give recommendations when it came to supplementation or anything else that I could add in and tweaks, because I don't think it really matters what form something comes to me in, whether it's a chronic illness or whatever else. We still have to look at the whole body and how all of the systems are working together. Yeah, and the dangers that may be there in terms of the risks later down the line, whether it's cardiovascular disease, you know, and it could be something as simple as, you know, getting back to the core basics of managing blood glucose with somebody, but it's even getting those really dialed in, I suppose, then has the after effect of bringing down the risk factors later in life. So you'll see the trickle effect into all areas of health.
This is the bit that intrigues me, Eileen. It's the risk factors later in life.
Yeah.
You know, okay, we'll get to that in a sec. When you kicked off in 2016 working with women in this particular area, what on average is the percentage difference of women who were coming to you to discuss this, and I would say women who are banging down your door now to discuss this?
Oh, wow. Now that people realize there's a huge amount of, but it's very, what can I say? I suppose it's such a confidential area that people don't generally even talk about it, even within the groups. So it's DMs that I get, it's the emails that I get from people that are only, the penny is only really dropping when they see some of the infographics that I've put up there to say, you know, just be aware, here are some of the signs and symptoms that people have never been aware, that they would never have associated with perimenopause or with the menopause.
Okay, so this intrigues me as well, because I am not the kind of person who, if I had a question that I would DM somebody, I would ask the question publicly, because I'm in the very fortunate position that I don't really care about what anybody thinks. But also I'm coming from the perspective of, if I have this question, I know there's 20 other women have that question. And I'm a big believer in the shared learning space. So in my the world that I operate in, it's obviously very personal. There's an awful lot of confidential information. And I think that, and I'm asking you, are you having the same experience, that women are ashamed?
Very much so. There's a huge amount of shame, because when I look at somebody and I start out with the process, we have to go right back into their, basically before they were even born, what's happened throughout their life. So we create a timeline, and to see the various different events, whether it's been a trauma, you know, or whatever emotional upheaval, whether it's divorce, you know, childbirth in itself just can cause you know, its own depletions within the body when it comes to nutrients and things like that. So it's mapping everything so that a client can actually see the impact of everything that has happened to that up until that date in their life has huge consequences on what's going on, for whether it's a chronic illness or just coming from something simple as, you know, a digestive issue that's only just kicking off. But they'll see that there's been a manifestation all along of everything coming together. And for me, when I see, I'm just to get back to that about you being able to use that shared learning space so that somebody else can learn, it isn't quite so simple for those that are feeling that kind of shame, because they don't necessarily want to go into a group and say, is anybody else suffering with vaginal dryness?
Yeah,
You know, for a lot of women, they're just
they're
closed off and they're
mortified.
thinking, what's going on? And they're thinking, why have I no interest in my partner? You know, sex life has gone out the window for some women. And they're just feeling that there's something wrong with them, you know, intrinsically.
They think it's
And
a very
and the
person. They
shame
think
around
it's
it.
an individual thing.
That's it. That's it. Oh, it could only be me. It could only be
Yeah.
my partner and I. Maybe we're the issue, you know, as in
And
the
see the way you
dynamic.
said there, that's very interesting. See the way you said there, oh, that could only be me.
Yeah. Yeah.
When women are coming to me for whatever challenges that they're having in their life or in their relationships or how they're managing their boundaries, they think it's only them.
They take that weight on their shoulders. They take on the weight of all the relationships that they have, whether it's even with children, and they just say it's completely up to them.
It's completely me. And they think it's not possible for anybody else to think the way I think. It's not possible for anybody else to feel the way I feel. And as you and I well know, we're all more similar than we are different.
Oh, without a doubt.
Why I love the podcasty, the shared space for the learning. It's how we're all going to grow and live our best lives, I think.
That's exactly it. And the more that I get to share some of these stories with women, the more that I actually am expanding as a person, because it brings me to a place of far more empathy, you know, and being able to just see and recognize the dynamic in somebody that may be struggling and that may seem as somebody who might be even closed off, or, you know, may seem in a bad mood, but you'll know that underneath all that, there's something far, far deeper that's brewing, especially at this age group. And this is a very vulnerable age group as well, when you think about it, Nicola, because
well, we have the highest suicide rate.
Absolutely, highest suicide rate. It starts to ramp up in and around that 50 to 51. And that's the average age of menopause for women, is about the age of 51. And for those that aren't aware, menopause itself is actually when you've hit 12 months plus a day of having no periods, you know, and then you can be classed as menopause. And from there on out, for the rest of your life, you'll be menopausal, as they say. But prior to that, in the years run up, that perimenopause can stretch to 15 years for some people. And a lot of women don't realize that that's something that might even be happening in the late 30s, mid to late 30s, can actually be
Do you want to give us
menopause.
the highlights? Let's do a timeline for women who have never, listen, I have to tell you, Eileen, up until last year, I had never even heard of the word perimenopause.
Okay. And you know, many women may not even have heard of it as well. They may have heard menopause in the years gone by, or the change, because this is another thing, that taboo area that we've been brought up with, even when it comes to just around periods. I'm talking about period health, menstruation, you name it. We've been brought up, certainly in my era, it was like the curse, the friend, you know, nobody could actually say the words. And it absolutely blew my mind when I did get to a stage of going, why are we being so like shut off about even saying the word, you know, about blood, even showing blood, or something that represents blood when it comes to even the advertisements, you know. And you're just, for the perimenopause, when women start to put that clinical picture together for themselves, they'll get little snippets from their friends, maybe, of struggling with, whether it's, you know, sleep is starting to go out the window. For a lot of people, that could be that, or they're noticing a little bit of the hot flushes setting in, you know, or their skin is changing in some way, shape, or form. Hair, for a lot of women, it's hair loss. But those can be very subtle signs that start a long time before you suddenly go, oh my goodness, for the last 4 or 5 years, I've been struggling with sleep, I've been struggling with energy, you know, my weight has started to creep up, especially if the weight around the middle is starting to creep up for some women, and they're thinking, hang on a second, I haven't changed what I'm eating. I'm still exercising. Or they push it up even more and they try to lose more weight and drop more calories. And then they're just stagnating. And that can really turn somebody in on themselves. Then they start to lose confidence. They're not feeling as though they're as capable, perhaps, when it comes to family or work.
Absolutely. All
and
that
anxiety.
And Eileen, I have to tell you, like, I'm not backwards and going forwards when I'm thinking that I'm fairly clued in. But I can tell you, the day that I lay on that sofa and I realized, when the penny dropped for me, because it was like there was a very large puzzle that I couldn't put together.
Yeah.
So I had a lot of different things going on. But it was only when I did look at them in sequence and I went, hang on a minute, this is what they're all talking about? Because what happens is, and it's really important for my listeners to know this, nobody knocks on the door on a Tuesday at 4 o'clock with a bag of all the symptoms of perimenopause and says, listen, chick, here's the perimenopause. It doesn't happen.
It doesn't happen like that.
It happens gradually. You might get one and have one for 4 or 6 months. You might have two and they happened at 2 different times. You might have 8 and it happened over 4 years.
Yeah.
So what, as we always say in the spiritual development world, is what you accommodate, you tolerate.
Yeah.
So when you accommodate one symptom and then you just get used to it, and you're, I'm putting that down to this, and I'm getting a bit older, and that's grand. And then if you accommodate that, that becomes part of your life. You habituate to that. And then 6 months later, something else happens.
That's exactly it, Nicola. But I think that the crucial thing I want people to understand is that even if you're seeing those small signs creeping in and whatever else, it's really important to work with your healthcare provider, whether it's going to your GP, discussing what you're feeling, and not being pushed aside in terms of, how you feel. So you're the best person to know exactly what's going on in your body. So nobody can tell you how you do feel.
Eileen?
I think
I love my doctor.
To talk to the doctor?
Yeah, like I love my doctor. He is a wonderful man. He is extraordinarily knowledgeable. He is he's personable. He takes an interest. I know he cares about me. But the unfortunate part was there was no education for my doctor around menopause.
And
so
that's
he was
the case for many GPs.
He was coming from a minus.
Yes.
So I was left educating him.
Yeah,
So
and that's the way forward.
Yeah. What would you say to women who are find themselves in my position, who go to their GP and their GP just has not been educated? What would you say to women in that position?
I think that the most important thing then to recognize ahead of time is to create your own diary, your symptom diary, so that you have everything written down, how you're feeling on given days, what you've noticed, whether there's changes in your frequency of urine. There's lots of different things that we can track. You can track your body temperature, your period, like how long or how far apart your periods are, all that kind of thing. So cycle tracking, we call that. If you start to build that picture up when you notice that there's something not quite right here, you'll not only be able to go with those symptoms and ask, could this be perimenopause? You'll also be able to say to your doctor, because there's such an overlap in symptoms with things like, because it's not always perimenopause, it could be something like anemia for some women if they see hair loss.
I'm so glad you said that.
Yeah, there are many other things that can look like perimenopause.
Yes.
So, you hear hoofs and you're going to automatically assume
yes.
But we're just thinking of, okay, can we rule out these other things? Because for me, they really do start to look like each other. So if you're looking at somebody who has insulin resistance, so that basically is, pre-diabetic into diabetes, into what we call metabolic syndrome now, you're looking at somebody who could have all of those signs of perimenopause, but they may not actually be perimenopausal when we get that blood sugar under control and start to bring all of the hormones back into balance, including insulin, which is really critical, at this stage, especially for prevention of cardiovascular disease, for dementia going forward as well.
Can I ask you a question on that, Eileen?
Sure, yeah.
Are you making a connection there between insulin and menopause?
Absolutely, without a shadow of a doubt.
So preach, sister, preach.
So if we're looking at blood sugar, so if you're having fluctuations of your blood sugar every single day, so that blood glucose that we measure, so you're taking in your food, you take your food and your body breaks it down into energy. And if there's too high a rush of sugar into the bloodstream, that's detrimental to your blood vessels and everything else. And it can cause a lot of those signs and symptoms of whether it's, anxiety, just irritability and everything else that goes with it. And when there's a drop in blood glucose later, which can happen to women in particular at nighttime, it happens to men as well, and when the blood sugar crashes completely because they're so erratic. It's like a roller coaster throughout the day. And when we can start to bring those back into just this gentle rhythm, a lot of those signs and symptoms of the hot sweats and everything else can actually be dialed down.
Now,
and you can
Eileen
bring
Burke,
things
you know what
back
you're
into
after doing
line.
right now? You're after proving to me that that was another symptom that I had and I didn't even know.
Okay. So you do feel that you maybe had dysregulated blood sugar.
I totally,
eating.
I was
Okay.
flat out with my GP talking about this.
Yeah. And I do have a lot of infographics. I'll actually share them with you later on, that you can show them to people where the overlap is, whether it's with thyroid, low or high functioning thyroid, like hyper functioning, with insulin resistance, and you'll see that they really do kind of they mimic each other in a sense.
I'm going to be able to, for anybody who's listening to this now, I'm going to be able to link you straight back to Eileen Burke.
Yeah.
Because I'm telling you, lads.
Oh, I'd be happy to help anyone that wants to get in touch, you know.
I've been speaking to Eileen professionally for about maybe 2.5, 3 years now, and she has spoken in my groups. I've spoken to her personally, and I don't do business with people who I don't highly, highly recommend, and Eileen Burke is one of them.
Thank you, Nicola. Appreciate that.
No, I've sent a good few people your way, actually, on purpose. But it's interesting that you bring up the anemia thing as well, Eileen, because I was diagnosed with pernicious anemia when I was about 20. And it took me a long time to be able to understand that, educate myself. Again, there's a paragraph on it for GPs when they're being trained. There should be a whole year, I think, to train people on the lack of what B12 does to people. So another thing that I did was, when I was experiencing these symptoms, is I was putting everything down to pernicious anemia.
Yeah. And it's easy to do that. We can just see one thing and we get so hyper focused on it that we're intent on it. And this is where I also want to get across the idea that rather than jumping to a solution, there's never going to be just one solution.
Yes, agreed.
And I'm not a medic, I'm not a GP, so I can't diagnose or treat anything. Like, you know, I can use the therapeutics that I use, and I know about HRT, but I can't prescribe it. I wouldn't advise people on it. What I can say is to jump straight to HRT without looking at anything else that may be a root cause, because I think without finding out what your particular individual root cause is, it isn't going to help you down the line. All you're going to be doing is adding in possibly some of those hormones that may not be what was the issue in the first place. You really do have to dial in all the core basics of your sleep, your hydration, you know, your exercise and your movement, and protecting your adrenal glands. So that's stress management, stress and sleep, those two things, they are absolute when it comes to disease. If you're not sleeping, and also if you're not pooping, you know, and your blood sugars are completely out of alignment, you can't really have a bedrock of good fundamental health.
No.
You know, it's just not possible. You have to get those into, and I know it can be difficult for people that are maybe feeling flat out, fatigued, you know, can't get off the sofa, you know, and maybe even to get to sleep at night. Perhaps some women are using alcohol to get to sleep. They feel that they're getting to sleep with that, but unfortunately, that's actually a form of sedation. Not getting into a proper restful, deep, restorative sleep. And also it's adding to the burden on the liver for detoxifying any of your old hormones.
Oh, that's a vicious circle right there.
It just quite literally, And
okay, I found this on the web for you're not sleeping.
Siri's talking to me.
Thanks, Siri, for joining the podcast.
Thanks, Siri. Oh, she's just very attentive. She absolutely is so helpful.
She cares, Eileen. She cares.
But you really do have to, you know, it will come back to how well is your body able to detoxify any of those. It's not just the old hormones. So anything that's broken down is broken down by the liver, but it has to get passed out through the bowel. So you need to be able to, you know, get fiber into the body to move out any old waste, basically. So you've got this waste system, but that waste system also is activated at night in terms of even clearing out anything from the brain. It's a little bit like a car wash at night time. So if you think about it, the fluid can go up in and give a little scrub. But if you're not getting into the stages of sleep that are necessary to reach that, you're going to wake up with the hot flushes. You're going to wake up if you have sleep apnea. If anyone tells you that you snore, or you happen to have, if you know you have apnea, that's one of the risk factors for cardiovascular disease going forward. So even getting to the root of that as well is really important, and to go and speak to a GP if you know that you're signs of that, because that means lack of oxygen to your brain. It's going to wake you up. So even something as simple as mouth taping until you can really get dialed in when it comes to the GP, to start something like that, that can help you to get the oxygen back into the brain at night time, you know, optimizing your temperature. So for me, I'd start with the sleep. I'd start with making sure that your liver is in tip-top shape. You know, I'm not here to preach no alcohol or anything else to anyone else. You know, I made a personal choice to only have alcohol every now and then, so it's very infrequent, because I know I can't tolerate it, and it does have an effect on my blood sugar. It has an effect on my sleep, and I'm just not willing to do that going forward. I want to prevent dementia. I want to prevent dementia, cardiovascular disease. Oh, these are my reasons. I think, Nicola, you'd know this as well as anybody, and you preach this to people. You've got to know your why. Yeah. Why are you considering making changes? Because if you don't know that real core why, you can just go, you know what? I don't fancy doing it today. I don't fancy getting up off the couch and going for the walk. That will help my health in the long term, you know.
Always have your why in the forefront of your mind.
You
know? And remind, that's why what you surround yourself with is what you become. That's why all of these statements of things that I want and have are around me all the time. Like, I can't walk through my hall without reading things or passing by things that are encouraging me for me to be the best possible version of myself. And
it's those tiny habits, those little habits that we can attach to something that's already in place in the day, like boiling the kettle. You're waiting there for it to boil. Why not try and do a few squats or something like that if you can? It's attaching it onto something that's already built into your day, that's an automatic habit that you have. Attach something else to it. And little by little, they just become something you don't even have to think about, you know.
Absolutely. I want to close off the perimenopause phase and move into the menopause phase. But when we're doing that, I just want to say that from in the last couple of weeks with the live streams that I've done with regard to perimenopause, menopause and HRT, lads, I can't keep up with the messages and the comments and the share. Like, it's actually phenomenal. It blew me away. Okay. But for me, a lot of women, the feedback that I'm getting, a lot of women only associated perimenopause or menopause with hot flushes.
That's always been the one that people are happy to talk about, you know, but there are so many more symptoms.
And that was the one that came to me last, right? Okay. So the ones that I experienced were the only way I can describe it is fizziness underneath my skin. It felt like fizz. I felt like there was fizz and itchiness underneath my skin.
Okay. And when you say itchiness, that says to me that even something like that can be histamine, and histamine intolerance can really ramp up. And the more estrogen that's in the body in and around this time, now it sounds like, yes, estrogen is dropping, but progesterone, the other key hormone that goes along with this phase, because people kind of forget about progesterone, but it is one of your best hormones for calming anxiety and everything else, it drops a lot faster. So there's this gap that it seems like then that there's so much of a dominance, we'll say, but it's not necessarily that estrogen has increased. It's just there's more there than there is progesterone. And that in some people can also lead to more histamine in the body. And histamine is something that's triggered when there's like those allergy symptoms. So you're looking at something like the itchiness, you know, and the eyes irritated, but it can also happen in the brain. So an irritated brain, so to speak.
Eileen, I'm telling you, I used to lie on that sofa with the fizz underneath my skin, my brain and behind my eyes feeling just weird. I'd be exhausted. It'd be like I'd get a bat to the side of the head with the exhaustion. And I used to say to Neil, when I copped that this could be perimenopause, I said to Neil, I literally can feel the hormones leaving my body. I can literally feel it. It's an experience now at this stage. The other thing that happened to me was I was going to the bathroom more often for a wee. Okay. Sleep was disturbed, restless leg syndrome, anger,
flashes of anger, irritability. Yeah, absolutely. Yeah,
not to 100, as they say in this house.
Absolutely. And just not having the tolerance that you may have had before, and add to that, you know, for a lot of women that may actually be at that stage of life, which we call the sandwich generation. So you may have elderly parents that you're coping with that may have health difficulties, and you may have hormonal teenagers as well in the house. So you're getting it on both sides, and perhaps you're just feeling that pressure of that responsibility and everything else, and the tolerance level just goes out the window.
Absolutely.
Patience. Yeah.
What else did I experience along with the anger? I was
Forgetfulness.
Oh, listen. I said that on a podcast the other day. I was like, I forgot what I was talking about. Let's just move on. And I called it out as perimenopause. Yeah, because I tried to put the iron into the fridge and all one day.
Okay.
Okay.
And that's, you'll have many women putting their hands up and saying, we all have had experiences of walking into a room and saying 10 seconds later, what did I come in here for? Yeah. That can happen, but it's not to be fearful of saying immediately, jump into the conclusion that I'm starting to, get signs of dementia.
Oh, I totally did.
It has to do with that drop in hormones,
I had said to the lads, listen, this is the gig.
Yeah.
Lads, I'm probably heading for early dementia. This is what's happening. And I feel really bad for you. Just stick me in a home. That's what I was telling them. I had myself convinced about Eileen that I was going to be one of these young women. And what I will say to you is now, when my mother-in-law was in the home, she recently passed away, but when we'd visit her in the home, there was one or two, Eileen, very, very young women who were rocking around holding a pillow. And I said to myself, is this dementia? Is this Alzheimer's, or is this something else?
Could possibly be something else. And the unfortunate part is that for some people, yes, there's that genetic component, and people may be susceptible, whether it's early Alzheimer's, dementia, or late onset. I know I have the risk factors for the late onset Alzheimer's. I have one parent with Alzheimer's and one with cognitive decline. So I know that is a possibility in my future if I don't do something about it now.
Yes.
So any of the factors that I put into place now are about protection and prevention.
Yeah.
So that's where a why comes from. They also have cardiovascular disease. So that drop in the hormones, I know, especially because estrogen is protective for your blood vessels and for your heart and everything else. And when that's dropping, this is why women catch up with men. Although prior to perimenopause, we have a protective effect. Because of the estrogen, that we actually catch up with men and actually can pass them out in terms of the rate of heart disease. Yes. Because heart disease is the number one killer for women.
Yes.
And not being cognizant of that fact just can leave you then, very, very vulnerable over the next 10 to 15 years if you're not dialing in all the other factors, like making sure that that you're getting the blood sugar stable, that you're getting the high quality sleep, and dialing back the stress.
Yeah,
as much as you can. Like, nobody's going to be stress free. That's not what life is about.
No, and we all need
it's about how you handle it.
Stress. We need a small amount of stress.
Yeah.
So, what other symptoms can you think of off the top of your head that I haven't already mentioned?
There are so many, Nicola, and I can.
No, you give.
I'll give you. Oh, it's even just images. I'll show you the images where people can see that. It can be something like the forgetfulness, the irritability, but you're going through other things like, even signs of maybe asthma. So you're looking at things that may have started that may never have been there before, but that's then coming back to that whole histamine and the different kind of systems that are affected by the drop in the estrogen and the drop in progesterone as well. Like, progesterone is that calming hormone. So when that drops off, you don't have what's known as GABA in the brain, or at least you don't have the same effects of GABA. You're going to rush more likely to anxiety. So when you feel anxiety, you're looking at the drop in the progesterone as much as you're looking at the effects of the drop of estrogen as well. Yeah. When you're looking at your forgetfulness, you're looking at how those hormones used to have a protective effect on the center in the brain that helps with that memory storage.
Yeah.
And as they drop off, it does leave the female brain in particular vulnerable because of these changes. Your whole brain is going through restructuring, remodeling.
Yes.
And estrogen is necessary for that,
yes.
To be protective. But for estrogen, it could be, digestive symptoms for some people, that they're struggling suddenly with constipation. They're not feeling that they can even digest fats very well, because you need estrogen to also help to create bile, and bile comes from your liver, and it helps to break down the fats in the food, and also it's like an antiseptic. Yes. in the intestine to help things to move through, because you want things moving through.
Absolutely.
You should be pooping at least once a day, and if you're not, that's constipation. There's an issue going on. Yeah. And for some people, they may feel that it's normal, that they may not even be going to the bathroom maybe once every 3 days, 4 days. Yes. It could be longer for some people. That's severe constipation, you know, you should
Yes.
at least minimum once a day,
Yes.
properly formed.
And you and I spoke about this a couple of years ago with regard to my poop. That was the start of it for me.
You got curious about it and what was happening.
Yeah, because I was like always regular and now I'm not. Like, what's all that about?
Yeah. And everything just slows down. And that makes sense as you see the drop off then in those hormones, or you see also the ramp up in a type of within your digestive system. You've got this family, a colony of bacteria. So you've got what's known as the microbiome in there. So all these microbes, all these bacteria, there's obviously viruses and parasites and everything else in there, but the bacteria are working hopefully to create health for you. So you've got good and bad in there, but you want more good than bad. And when you're feeding them types of foods that they thrive on, you're going to get the benefits of being able to move things out of the body with ease, going to the bathroom every day. You know, it's also going to create a lot of the happy hormones for you as well, a lot of good vitamins. But when they're malnourished, shall we say, by not getting enough fiber and other crucial nutrients, suddenly the bad guys can take over. And that's when we can start to get this picture of some of your old hormones being recirculated throughout the body and causing chaos. So joint pain. So you asked about more of the symptoms. So for a lot of women, they say that they wake up in the morning and their joints, whether it's finger joints, their knees, their hips.
Yeah, I had all that.
Yeah, and a lot of that can be from that kind of inflammation picture that is set up by this phase of life as well. But it also links back into insulin resistance. And we're going to start seeing all the different pictures coming together. So it's really crucial that somebody can say to themselves, these are all the symptoms that I'm feeling. If it's not perimenopause, you need to figure out what else it is, you know, because you're not going to just jump into sticking a band-aid on a bullet wound, as they say, without extracting the bullet.
Absolutely. So, the only other thing that I can think of as well was the jumpiness. I was really jumpy. I was on edge. Totally on edge, unnecessarily.
Startled. That is one of the signs that I would say, to be startled or to feel that you can never get into that deep, restful sleep, that you're always listening out for something going on or something. Like it's a bit like the waiting on the shoe to drop kind of thing, you know? Yeah.
Okay. So now we're up to menopause. And as you quite rightly said, menopause is when you have missed a period for a year and 1 day.
Yeah. Then you're officially menopausal.
Now I have to tell you, I'm looking forward to that bit.
But you see, Nicola, so many women say that because they've suffered with symptoms, and they don't need to. It's common that people have symptoms, but it's not necessarily normal, because what we want to do in the run up to menopause, the longer you can keep your natural hormonal rhythm of your own body, your identical body hormones, so as in the ones that you create yourself, the longer you can keep those and sustain them, the easier your transition will be. So it's making sure that your monthly cycles for women that are cycling, that happen to have the uterus, that are having their period and everything else, will see then whether ovulation is occurring, even if it starts to stutter a little bit. And it will get shorter, the periods will get shorter, all that kind of thing. But if we can actually get to ovulation every single month, even in our 40s, you know, you may not want to get pregnant. It's not about that. It's about creating the hormones, because it's only after an egg has been released that progesterone comes into the picture. So it's only for half the cycle. So for women, when they suddenly the penny drops, that all along they might be, you know, maybe taking birth control or whatever else that's suppressing all those hormones and not getting the benefit of their own natural progesterone. So the PMS symptoms, PMT, when you see those kind of symptoms coming in, that's a lack of progesterone for the most part. And so what we want to do is just, you know, encourage as long as possible to have a natural cycle. And by doing that, you're going to have the benefits of those good, robust hormones, you know, and you may be able to get the most out of them for the next 1 or 2 years. And of course, you can get the, you know, the aid of whether it's a little bit of a, you know, boost in estrogen when necessary, you know, but that's something to talk to a GP about. But for the most part, you want your own hormones.
Now listen, I'm very lucky, Eileen, because you could literally time my periods to your clock. And I know when I'm ovulating because I can feel that I'm ovulating.
Middle schmerz, it's known as.
Working hard. Working hard. Now,
and many women can feel that.
Ovulation actually used to be painful for me. It's not so painful in the last number of months, which I don't know is a good thing or a bad thing. But I'm all on for keeping it for as long as I can to get the natural benefits. But when the inevitable is going to occur of when I do go into menopause, I'm not fearful of it now.
Yeah, you know much more about it. You know what's likely to come for you, but
Yeah.
you'll also be aware of, in particular, the benefits going forward of anything that you do, the good strategies, those lifestyle measures, and making sure nutrition is really dialed in to protect your cardiovascular system, to protect your brain health and everything else. It's making those choices going forward. Then it will lead then to, you know, greater levels of energy. It'll lead to greater levels of concentration. Concentration for me sometimes was, you know, a few years ago was, oh, wow, was like that. I was missing out on words, couldn't remember a few different things. What was I doing? I could get focused on some things, and then other times I just couldn't. It just was that scattered brain kind of feeling.
Yeah.
You know, but going forward, making sure that all that nutrition is dialed in, so you're not feeling that, so that you are not fearful about even going back to work. For many women in the workplace, they just they feel, oh no, I can't face into this in the menopause and perimenopause, you know, that they that sense of self-esteem, self-confidence is just rattled completely. You know?
Like we've lost so many women in business in the
Yeah.
last number of years, literally through a lack of support and education for them, that they didn't get what they needed in order to be able to operate at the same levels as they normally would. Now, I have a question for you with regard to periods. Is there a correlation between perimenopause and heavy bleeding?
There is, yeah. If you think of that, when I mentioned progesterone, if there's very little progesterone coming in there in the first half of your period, you've got that estrogen there, and it's building up, and it's building a nice, beautiful lining within the uterus. So that's exactly what should be happening. And what progesterone does is it holds it in there to sustain a pregnancy if a pregnancy were to occur, but then afterwards, no pregnancy, and then you allow that lining to release. But when there's no progesterone there to prevent estrogen from keeping on that growth and everything else, the lining can build up and build up. And then it's an overgrowth of tissue, basically, because that's what estrogen is. It's a growth hormone. It's about building. Let's go back to puberty. For young women, you're looking at that ramp up in estrogen because they're about to start to create breasts. The hips are going to get bigger. So it is about growth, you know, whereas the progesterone is just that little opposing factor that comes in there to balance it out. So you need to have them in a right ratio. But if progesterone is not there to do that, you can get an overgrowth, like an over proliferation, as it's called. So too much.
Because I tell you, Eileen, the periods in the last 2 or 3 years, heavy. There hasn't been a word invented yet.
Yeah, flooding. A lot of women would see it as flooding, and they may speak about it in terms of flooding. And this is where we come back to the workplace, even for somebody who's just fearful. Not only do they think that they're losing their mind, they're feeling so much anxiety. Are they capable of doing their job any longer? But they also don't want to have these instances occur of having to run to the bathroom. Are they going to be destroyed when they get up out of a chair?
Destroyed.
Many women have those fears, Nicola, and like, you're not alone if you happen to have that fear. And I need women to know that these things, yes, they may be a fear, but there are things that you can do about them, you know.
But also, I want people to know that may be an indication, because you know the way some people might get some symptoms and not others.
Yes. And some women get none.
And so Eileen. It's these
they're the lucky ones.
It's the women who don't have the symptoms that scare me the most, because then they think that they don't need it. But my main concern right now is the other end of your life, you know, is
active effects of those hormones. You know, and you'll have a shift over from when the ovaries start to really, let's say that they've shut down, they're not producing eggs anymore, and you just stop your period. Your adrenals basically should take over producing. You'll still produce a small level of estrogen and progesterone if your adrenal glands, and the adrenals are just sitting above the kidneys, so at the back of the body. So they're just two little organs, but they produce so much in terms of crucial hormones. So you're looking at something like cortisol, which is a stress hormone. And when that's very, very high, what it's basically doing is it's telling the body, we don't have, you know, the capacity to, you know, to produce a pregnancy. It's fight or flight right now. there's nothing else that's going to go on, not even digestion. We just stop all of that. So it's not going to preferentially make those hormones for you that are protective in the sex hormones. It's just going to say, no, hang on a second, we got to survive today. So when you're constantly churning out those stress hormones, it's just pushing everything else to the wayside.
And then your immunity is gone.
Yes, absolutely. And blood pressure starts to go.
That's what happened to me when I was a child. That's how I lost my immunity, was through cortisol, actually.
Okay. So very high cortisol. And then some people can swing to low cortisol as well.
Yeah.
You know, and even coming back to when I mentioned earlier about the estrogen and has that role with bile and everything else, that when you see that drop in estrogen, you'll also see a rise in cholesterol, LDL cholesterol for people. So they can go to their GP, they'll suddenly see that their LDL, they're being told that you're very high cholesterol, and they may be put on a statin or something like that, or encouraged to go on a statin. Whereas I'd be saying, but hang on, let's come back to basics. Let's get all those root causes out of the way first. Go back to the why, go back to the foundations before. It's not to say don't take the advice of a doctor. Of course, you listen to what they have to say, but you also want to know, what can I do beforehand? Can I wait a little bit longer before I go to that level? Because you really have to have the foundations in place first for help, you know?
Absolutely. Okay. So we don't have our periods for a year and a day. Yeah. And then what happens?
Yeah, it's about nourishing the adrenal glands at that stage. So you are looking at, you know, getting those, the lifestyle practices like your yoga, your breath work, anything that will help to keep that cortisol under control. But it's also about keeping your blood sugar. We're always going to come back to blood sugar.
I'm taking notes now, Eileen.
No, yeah, absolutely.
I'm writing this down.
And I know that a big question for women, especially in menopause, is about weight, because they're saying none of the things I've done in the past are working. I'm not losing the weight that, you know, that I used to easily drop, like 10 pounds. That becomes a huge concern. And unfortunately, then sometimes people can tend to undereat. So what we want to look at is actually bringing up the level of protein, high quality protein that you're bringing into the diet. So that can help to stabilize not only your hormones and, you know, your brain chemicals, the happy hormones and everything else, but it helps with weight management across the board and with feeling of satiety. So satiety basically means that level of, I'm satisfied with what I've eaten right now, because women will say cravings, number one, you know, that can be in perimenopause, but it can also be in menopause, you know, that they just say, I eat all around me. Yeah, you know, like there's no off switch. And that can come from that drive of, you know, the blood sugars being out of control and that fatigue, and when the blood sugars drop. But it can equally be because people are just emotionally just unable to cope, and they're suddenly jumping into the emotional eating, and it becomes a habit, it becomes a behavior, it's a comfort in a sense. You know, they go back to that, and then they beat themselves up, and it's like this vicious cycle.
I know.
You know?
And you know, it breaks my heart. I've seen it a lot in the last couple of weeks of comments on Facebook on the live streams that I did on HRT, is women saying, I gained weight, so I stopped taking HRT.
Okay. Yeah. But see, this is where, when you get the others in place first, have your good foundations, and then have that conversation about what HRT is right for you. There are a number of different types of estrogen and progestins or progesterone. Ideally, you want to be taking something known as body identicals. Now, as I said, I can't prescribe, so all I can do is just tell you what's there. I wouldn't start to recommend to anyone. Only recently, like within the last 2 to 3 weeks, I started to take just a low dose of the estradiol. So that's so that's an estrogen that's closest to the body identical. And then also a progesterone just for half of that cycle. Because when I mentioned earlier, progesterone is only produced in the second half. Well, to any great effect, there's like baseline level, that's it in the first part of the menstrual cycle, and afterwards progesterone. Now, you really do have to get somebody, as you said earlier, some GPs don't know about this area. Go to somebody who knows a lot about perimenopause and menopause, and that can recommend based on your unique circumstances. So for some women, they may be fearful of taking HRT because they may have gone through breast cancer or something like that. They need to go and have that specific conversation around that. Is it safe for them to have maybe localized estrogen? They need to have that conversation with somebody who's up to date on the literature and knows what it means today to take something that's body identical, not in an oral form, because that has to go through the body systemically and through the liver and everything else. But maybe perhaps something might work for someone that's actually put in a localized area. You can use things like, the localized creams or gels. When women say that their sex life has gone out the window, for many women, it's not just because libido they are just suffering huge pain.
Yeah.
I've heard women say it's like razor blades to
Yes.
even have intercourse.
Yeah.
And that's because the drop in that estrogen and not replacing it can leave that tissue very friable. So it literally just breaks apart, that it becomes stiff. So if you think of estrogen, it's something about plumpness.
Yes.
When I mentioned growth earlier, talking about plump, fresh skin and everything else that goes with it. Same with the breasts, same with the tissue of the vulva and the vagina and everything else. It helps that wall, the structural integrity. And when it drops away, it just leaves it withered, shall we say.
Yeah.
Withered is
sawdust going around, sawdust, Eileen.
Yeah, but how many women want to have that conversation? And how many women want to have that conversation with their partner, let alone with a female friend?
I know.
It's not necessarily the topic of conversation that people want to be having at dinner, but more women should have these
Well,
conversations.
I think we should, Eileen. I think we should.
Absolutely.
Hence why I went on social media and told everybody about my whole life with HRT. For this reason, I just didn't want anybody else suffering the way I suffered.
Yeah, and
the word suffer, Eileen, I'm sure you've heard me speaking about this before. I can't stand the word suffer.
It makes you feel like a victim in a sense. Yeah.
There's no need for it,
No, there isn't. There could be a gentle transition, you see.
Yes.
And that's what this phase of life is, that it can be actually a transformative. And if we turn it to the positive, and if we can get those things in, it can create this whole new woman that comes alive in that. Let's say you've raised your family, all of a sudden you're coming into yourself with confidence and everything else. That's what you want to see emerging. It's like that, the butterfly emerging from the chrysalis. This is what you want to think of it as. And if you want to have those transformational kind of end results, you got to put in the work. It's not going to take just one pill, one diet, one whatever. It's going to take a lot more work.
A multitude. And also, Eileen, the whole suffering thing is when there's no action taken and you're not educated. But this can be an experience. And that's what I say about my work. You're either going to suffer something and let it own you, or experience something and you own it with knowledge.
That's it.
It's happening anyway.
Yeah,
it's happening anyway.
Yeah, and I just see it like anything that I have gone through in my own lifetime, as much as you have, Nicola. You just say to yourself, I can either learn from this and grow, or I can allow this to just kind of hold me down.
Chew me up.
Yeah. And for too long, I did allow some of those things to get in on top of me and kind of dictate who I was, how I interacted with people and everything else, for fear of what if people knew the real me on the inside, or what are the anxieties and, and holding on to that, because I would think of myself as quite an introverted person, but I mask it well because I talk a lot. But sometimes
that can be a nervous thing.
It is a nervous thing. For me, it is a nervous thing. But also I speak about something when I have passion for it.
Yeah.
And I get animated. Like there's no I know my face. When I talk with my face, I talk with my hands, but that's who I am. I become very, very animated. So for some people they can read my face like a book, because I can't hide anything. And even if I look like I'm worried or I'm puzzled about something, I might look like I have resting bitch face to some people. But it's not. It's maybe that my brain at that time is just trying to suppress a little bit of, oh my goodness, feeling that little bit of anxiety, or about to step onto, a stage to talk to students or whoever it happens to be. Of course, you're going to feel that rush of adrenaline and a little bit of imposter syndrome creeps in. And this is something in perimenopause for women as well. They start to doubt themselves. And I know I have done as well. And I just say to myself, hang on a second, I am extremely capable. I have to just every day get up and say that to myself.
Yeah, absolutely. Yeah. I have to say to me myself every day too. Question for you, Eileen. Talk to me about testosterone.
Testosterone in women. Testosterone is something that women don't realize. There's actually more testosterone in the female body than there is estrogen. But that testosterone, it's it's measured in different ways. And what we need testosterone for is basically, well, okay, it's for libido, it's for that ramp up when you're coming up to ovulation and you're starting to feel a little bit frisky, those kind of things. So it helps with the sex drive, it helps with all that. But testosterone in the body, inside in the ovaries, gets converted into estrogen. And when we don't have that conversion process going on, we can't produce that nice healthy estrogen within the ovaries. But equally, if there's too high of testosterone in the body, women can maybe suffer from something like polycystic ovarian syndrome. So all of those are linked in. So just to say that there would be no replacement of testosterone across the board in women would be a disservice. You know, but it's how it's managed is the thing. So down the line, if somebody knows that, okay, if they have chosen to go down the line of HRT, and the estrogen and or progesterone therapy is not necessarily doing anything when it comes to their libido or whatever else, they should be able to talk to their provider about, you know, is it going to be something that works for them? But you always have to test. You don't guess. You know, going back and checking where your levels are at as a female, and they should be within that range to help you to feel that, because it also is about confidence and everything else, and also about that alertness in the brain and having that kind of and all of these hormones working together can also have a wonderful effect on things like serotonin, on dopamine. So you're looking at rewards, you know, and that feel good kind of about yourself, about anything that you're doing, you know, they all drop at this time of life as well. So you want to make sure all of they have to work like a symphony. So all those hormones have to work like a symphony. If you think of it like an orchestra, one of them goes out of sync and then another, and then all of a sudden it just sounds, you know, a little chaotic. So what you want to do is bring them all back into a nice rhythm, but not just by one thing. We can never just do one thing. We have to look at the broader picture.
For me, Eileen, I was in a very lucky position that I didn't have an issue with intimacy or libido or anything like that. And for me, when I spoke to my doctor about testosterone, it was nearly like the key for the other two to work properly. So I went specifically to discuss testosterone with regard to joint pain.
Yeah. And
I just didn't feel like, I felt like a part of my personality had left me. And it was scaring me. It was scaring me. And when I started to take testosterone, I take a little pea-sized piece of gel, stick it on my hip every morning. And for me, after a couple of days when it kicked in, I felt like I got me old funny self back, and that I was bopping around.
That was your missing piece.
I was actually up for the crack a little bit more. Do you know what I mean?
Yeah.
I kind of felt like my own personality had kind of dumbed down a little bit. And because I have such a big personality, it was really noticeable. Really noticeable. So the aches and pains are definitely less with regard to me taking testosterone. The one area in my body that it hasn't helped yet is my knees. So I've gone off and I'm waiting on the results of MRIs on my knees because I think there's another issue going on there. But I just wanted people to know that testosterone is an option.
It is another option to talk to a GP about, absolutely. And if we come back and actually go back a little bit to perimenopause, menopause, and we look at how all those hormones interact on bone health and on muscle health as well, when the testosterone drops, you're going to see like your lean tissue mass starts to drop down and fat mass increases within the body. So and fat can also get more estrogen, so you can have that estrogen dominant picture. But you need to have those hormones in there to help with your bone health, to prevent osteopenia, osteoporosis down the line, as much as you're talking about cardiovascular disease prevention and Alzheimer's. You know, you also want to be thinking, protect your bone density. Yes. So you want to have, you're not talking about putting in exorbitant amounts of any of these. You're just bringing them back to like a baseline level. So to what would naturally be there. Yeah, just a normal level. And they will peter out. It's not a case of, you know, that you're going to be just staying on high levels for the rest of your life. You just need something there to be brain protective. Because remember, Nicola, we don't have that long, you know, a clinical picture or research that goes back long enough, because years ago, people didn't live necessarily even to their menopause. You know, they may not have even had that longevity.
Yeah.
So it's only within this industrial era that we have our medications and we have much more, you know, ways of sustaining life for longer. And
we want quality of life, Eileen.
We want high quality. We don't want to end up of having 20 or 30 years of disease management, chronic illness, whatever it happens to be. Or, you want your best self going forward, and that includes your bone health here. And for women, that means get out there and do some resistance training, strength training to build up that muscle mass to help not only with the muscle development, but that also helps with your bone health. So you have to look at all of those pictures. Now, what comes into that is your nutrition as well. So you're never going to be ignoring your nutrition. You need to look at all of it, your vitamin D, your calcium, it's not going to be one thing, because I know people can say, oh, I have to just take calcium. It's a number of different factors for bone health as well. It's going to be those hormones, it's going to be vitamin D, it's calcium, it's vitamin K2, magnesium. It's a whole cluster, because we can focus in too much on one thing, and it's a very myopic view then that we can get, rather than having this broader system-wide.
Yes.
How can everything work together in harmony?
Yeah. Is there anything that you want to say on the food end before we wrap this up, Eileen?
I really will come back to just when someone gets their blood glucose, that blood sugar dialed in, it's going to be a case of what suits you. It's an individualized type of work that I do when it comes to it, because I'm not going to force somebody to change everything about their whole diet if it doesn't suit them. I'm going to work with them to add things in, especially something like the phytoestrogens. So you're looking at things that can have a mildly estrogenic effect to help in the body. If let's say there's somebody who can't take replacement hormone therapy, they can look at how foods can actually be supportive, and just to optimize your digestion, to make sure that you're getting the most out of your food as well, because if you're not breaking down the food, you can't extract the nutrients to then give you those protective effects for the heart health, for brain health, and everything else. Yeah.
Okay, Eileen, I could literally talk to you all day. I could just sit down with you now with a notepad and fill notepads worth of information every time I speak to you. Blow my mind every time I talk to you.
I've probably forgotten many things to even add in, but as I said, I do have a lot of the different infographics, and if anyone wants to, have a look at those, and just, as I said, symptom diary, food diary, bring it to your GP, work with somebody. Even if you want to work, it doesn't have to be with me, it can be with another nutritional therapist. If anyone wants to get in contact with me, they're more than welcome to. I'm happy to do
Eileen, where can we find
15 or 20 minutes. You'll find me I'm over on Facebook. I'm on Instagram at Eileen Burke NT. I have my website as well, which is eileenburke.ie, or they can just get in touch with me through you, Nicola, if that's the simplest way to just
I'm going to make sure that I put all of your contact details when we release this podcast. But Eileen, what I want to say to you is I'm so grateful to you for giving us your time, because I know how busy you are. I'm so grateful to you for the level of detail and information that you've given us, because I know for sure that your impact is going to not only impact one other woman, it's going to impact many other women. And we need to pull together. We need to keep speaking. We need to keep having conversations and lifting each other up, and bring it, widen the staircase for everybody else, and bring it along so that we can have this experience together rather than feeling like we're alone.
That's it. No woman should feel like they don't have that support at this time, and they should bring along their partners as well. I think that's important, that partners are educated, in terms of what's going on, so that we're not made a laughing stock, in a sense. When you think back to the old memes and jokes that used to go on about something, because as you said at the very beginning of the podcast, Nicola, this is a high risk time for women when it comes to depression, anxiety, and possible suicide at this age group, because of those stresses and the changes in mental health and everything else that goes along with it. So I would just say to get the partners on board. It's really imperative.
Like in all of the documentaries that I've watched in the last, say, year and a half, Davina, the one with our own Dr. Lundy, the other one the other night with Grania Shoga, my children and my husband have watched every single one of them. And I will tell you, it has brought us closer together as a family, because they can understand me more. They can understand me more. But I suppose the last thing that I would like for you to shed a bit of light on before we wrap this up is if you don't take HRT, what are the negative effects? Because we are living longer, What are the negative effects when we're in the later stages of life?
That drop off in estrogen is, as I said, you do need estrogen there in the brain, but I'll come back to those adrenal glands. You still want to know that you're going to be supportive of your adrenals going forward, because they're still going to be able to eke out a level of estrogen and a level of progesterone to just be protective within the body. So, somebody really has to go through. I couldn't give just a one line answer to that, because it will come down to that individual and what's going on for them. It'll come back to, are they on medications and everything else? So
but the risk factors, Eileen.
Risk factors are in particular cardiovascular disease.
Yeah.
The Alzheimer's. So you're looking at,
and I don't want this for women. This is the thing. Even if you don't have symptoms, you are still at a higher risk of heart attack, stroke, osteoporosis, dementia, Alzheimer's, all them things. Yeah, I want us to live our best lives for as long as we can, but I also want us to be able to climb mountains when we're 70.
That's it. Yeah. No. You want to have the energy. You want to have the vibrance. Kind of vibrancy. Yeah. That's it. Nicola.
Eileen, you're a legend. Thanks a million.
Thank you. Thanks a million for inviting me along as well.
You are most welcome. I'll talk to you again.
Okay.
Slán, bye.
Bye.
So guys, I really hope that you enjoyed that podcast as much as I enjoyed recording it. If this is something that you're interested in, keep an eye out for future podcasts or the previous ones that I've just released. And if you would like to continue your personal or spiritual development journey with me, I would be absolutely delighted to have you, and so would my team. Check out my website, nicolaconnollyburn.com, and go to the personal development section and fill in the forms and join one of the groups, either Soul Steps or Soul Works. We'll see you there. Take it easy. Slán.